So now I would like to introduce Charles Seaman. Charles is the supervisor for the Medicaid-funded departments of Senior Resource Alliance's Aging and Disability Resource Center. He oversees the teams that screen individuals for long-term care assistance and aid in the eligibility process for the statewide Medicaid managed care long-term care program.
Good afternoon. Hi, my name is Charles Seaman. I'm a supervisor for the Medicaid-funded departments of Senior Resource Alliance's Aging and Disability Resource Center. So that is, to put it simply, it's our call center. People will call in looking for information on programs and services that are available in the community. We're one of 11 agencies in the state of Florida. We oversee Brevard, Osceola, Orange, and Seminole counties. Oh, perfect. So today I'm going to just talk about what Senior Resource Alliance is and the Aging and Disability Resource Centers. Our model applies to other areas in the state, so for people coming from other areas, there is a map with phone numbers and places to contact if you're looking for services in your community, and how that breaks down into our Elder Helpline, our intake and our eligibility teams, and the programs that they assess for. So with that, Senior Resource Alliance, like I said, is one of 11 area agencies on aging, and we provide program information, community resources, and enrollment assistance for local, state, and federal Medicaid and non-Medicaid funded programs. These serve the aging and disabled population, so we provide information on programs and resources for people aged 18 and older, and we conduct screenings for programs that I'll talk about in a bit. Senior Resource Alliance specifically serves what is called PSA, or Planning and Service Area 7. That's Brevard, Orange, Osceola, and Seminole counties. If a person calls outside of this region, we'll direct them to the office that is appropriate for them for the services that they're looking for. Otherwise, the state has all of the agencies linked via a toll-free number that a person can call in. It'll direct them to the area based on where they're calling from. So here's a quick map of the 11 area agencies on aging. You can see us in the light green, serving Brevard, Osceola, Orange, and Seminole. But for people in, say, Polk or Hillsborough, you may want to contact Senior Connection Center. They're the area agency on aging for Western Central Florida. So I'll leave this up for a minute just so if anybody wants to take a picture to find the one that is maybe appropriate for them. Otherwise, again, the toll-free number, 1-800-96-ELDER, will direct you to the area agency on aging in your location, hopefully. Next slide. So, as an Aging and Disability Resource Center, Senior Resource Alliance does not directly provide services. So, when getting services through one of the programs I'm going to discuss today, it's not Senior Resource Alliance providing those services. We work with lead agencies, area agencies such as Seniors First or Aging Matters in Brevard, that do the case management and provide the services, or contract for services to be provided through home health agencies. What the Aging and Disability Resource Centers do is providing information and referrals to programs and services to help those in the community with their needs. They call in and they'll say, I'm looking for something like help in the home, utility assistance, or information on insurance plans. And we can get them connected to the correct programs or resources. And we can schedule for a screening for programs and services to provide help in the home. And when funding is available for programs, we can assist with the eligibility process. So the front door of our agency is the Elder Helpline. The Elder Helpline gathers demographic information about individuals who are calling in and seeking assistance. And they will provide referrals to resources that may be community partners, local agencies, state programs, or federal resources that can help with those needs. If a person's in need of services that can be accessed through a program that we screen for, our Elder Helpline and the information and referral specialists will set up an appointment to complete a phone screening to get information about the person's needs, what kind of help they need, and to determine what programs they may be eligible for. There are a couple of programs, some funded by Medicaid and some that are state funded, that we screen for and place people on the wait list for. So the first program I'm going to talk about today is called CCE, which stands for Community Care for the Elderly. Community Care for the Elderly is a state-funded program that serves people 60 and older, providing in-home assistance with needs related to activities of daily living or instrumental activities of daily living. These are things like bathing, dressing, eating, using the bathroom, transferring, mobility, and then things like heavy chores, light housekeeping, using a phone, balancing a checkbook, things of that nature. The services that CCE can provide are things like homemaking and personal care. It can provide respite for caregivers, either in the home or in a facility setting. It can provide things like home-delivered meals, either through a program like a local Meals on Wheels or frozen meal deliveries. It can provide assistance with things like durable medical equipment or consumable medical equipment. When a person is on the CCE program, they'll work with the case manager and to establish a care plan, identifying what needs they have and what kind of services can be provided. Since this is a program that is in its acronym for the elderly, it is for people that are 60 or older, and the eligibility need is just a functional need for assistance. So those tasks I mentioned earlier. For people that are under 60, there's a program called Community Care for Disabled Adults that is through the Department of Children and Families. So a person calling into our agency looking for that kind of help, we can get them connected to the agency that provides the assessment for that program. Funding for CCE programs is divided at the state level by county. So Orange County has a set amount, Brevard, Osceola, Seminole, etc. So as funding becomes available for these programs, they look at the people who have contacted Senior Resource Alliance and then identify those with the greatest need to get them connected to those services. With this program, it's not Medicaid funded, so there's no income limits, no asset requirements, but there may be a small copayment for services with this program based on a person's monthly income. The next program I'll just quickly touch on, it's called the Alzheimer's Disease Initiative. It's for caregivers of people with a diagnosis of Alzheimer's, dementia, or other memory-related impairments. It provides respite for caregivers. And again, funding for that program is based on the county. Next, we have Home Care for the Elderly. This is a state-funded program that provides a small monthly stipend for caregivers that live in the home with the person they're providing care for. The monthly stipend's about $160, but it helps with premium costs, costs for supplies or other needs. And it's for people that are 60 or older with a primary caregiver living in the home with them, and follows the Medicaid income and asset limits. So a person can't exceed set amounts for their income or for their assets to receive the assistance through this program. Right, so the last one I have here today, the long-term community care, or the statewide Medicaid managed care long-term care program, is a Medicaid-funded program that provides assistance in the home or can help if a person's in assisted living. It will help in paying for a portion of the cost, paying for the type of assistance that's provided to a person that's living in an assisted living facility. The statewide Medicaid managed care long-term care program is for people that are 65 or older, or that are 18 years or older and eligible for Medicaid by reason of disability. To get eligible for long-term community care, a person needs a level of care conducted by an in-home assessment by CARES, a bureau of the Department of Elder Affairs, and their income and assets have to fall within the Medicaid SSI-related financial eligibility standards. So right now, that standard is that a person cannot make more than $2,523 per month, or $5,046 per month if a couple is applying, and the asset limit is $2,000 for an individual, or $3,000 for a couple. And they look at things like bank accounts, investments like stocks or bonds, and property separate from one home or motor vehicle. These financial eligibility standards change periodically, 3 times a year, typically based on like the Social Security adjustments, cost of living adjustments, and changes to the federal poverty line. The most recent change to this program did occur last year, and a person has to get a rank of a 3 or higher when completing a telephone screening through the Area Agency on Aging to be eligible for the statewide Medicaid Managed Care Long-Term Care Program. What does that mean? That's next slide. So, the first step in getting connected to statewide Medicaid managed care, if you're seeking long-term care to help in the home, would be to contact the Aging and Disability Resource Center in your region. The Elder Helpline will gather demographic information about who's needing assistance, say if you're calling for a loved one, and if in need of services, they'll provide the information, the referral, and will schedule a screening to be conducted over the phone for long-term care programs. The screenings are completed by trained professionals. Our intake specialists are trained and certified in administering the tool that was created by the Department of Elder Affairs and is part of rule of law. And the screening usually